Well, joining me via Skype is public health specialist Dr. Kemi Odukoya. Good morning, and thank you for joining us on TVC Breakfast. From what the NCDC Director General has said, it says it's a complex situation, so to speak, and that no one approach could be the solution to the cases, the continuous rise in cases that we have found in recent days. Talk to us, how complex the situation this is that we have found ourselves.
Thank you very much. Yes, I do agree with the NCDC DG that it is a complex situation. And as Nigerians, we are a unique set of people. Now we have active community-based transmission. And we need to remember that with COVID, there are still a significant number of asymptomatic carriers. And what does that mean? There are people walking around who have no signs, no symptoms, or mild signs or symptoms, and they have COVID. They are able to transmit it to others, but you can't readily identify them. And that's a problem, because for every time we associate with people, we increase our risk of getting the disease. So as much as possible, we need to, it's tough because we are used to associating with people. It's in our culture. And now, as much as possible, we have to maintain physical and social distancing. We have to make sure we wash our hands as often and as frequently as possible and adhere to all the guidelines. It's also a challenge because in Nigeria and in other parts of the world as well, there are issues with a lot of myths that are coming on about COVID, so many things on social media. Now everybody is an expert. Some people, they're conspiracy theories that don't even allow people to go for testing. And that in itself is a challenge. But whichever way, I think we should follow the guidelines of the NCDC and the Ministry of Health. And Nigeria hasn't been doing as badly as some other countries. And over time, I think we will overcome the scourge of this virus.
Now, I'd like for us to go back to the issue of persons who are asymptomatic that you have mentioned. How complex does this aspect or this group of persons make the work difficult? Or how does it make the work difficult for the efforts being made by the government to flatten the curve at this point?
Yeah, thank you. Now, that's a problem both for the healthcare workers that are actively looking for cases and also for people around. Now, if you would recall, when we had a similar epidemic with Ebola, the advantages that we had, or what I would call it an advantage with Ebola, was that people who had Ebola were obviously ill. And because they were obviously ill, they were easy to identify, and they were less likely to be moving around. One of the main problems we have with COVID is the fact that sick people are moving around and are transmitting that virus. They are giving it to their family members, they're giving it to their colleagues, they're giving it to people around. And with that, you have an exponential rise in the number of cases, because one person can give it to 2 or 3 people who gives it to a couple of people. So the other thing that does make it complex is that it's not in our nature, particularly as Africans, to isolate. I'm not sure it's in any nature of any culture, but I think in Africa particularly, we're a very communal group of people. We live in groups, we work in groups, we enjoy in groups. So there's going to be a significant amount of behavioral change required for us to be able to beat the scourge of this disease.
Now, one situation I'd like for you to quickly touch on is the issue that is happening in Kano, where there seems to be a strange illness, and it has not been established if this is COVID-19, but it is generating some sort of concern, especially with the rate of deaths the state has witnessed so far.
Yes, it is. We do not know for sure whether those deaths were due to COVID-19. And we need to remember that before COVID-19, people were dying, yes, and we need to remember that. We do not know, but many times when people begin to die, maybe suddenly or in groups, it gives cause for concern. I would like to believe that the NCDC is aware of this. It is possible to test people post-mortem, i.e. after they are dead, and I would like to believe that the NCDC is doing this, so the people who died around that time, they can also get tested and we can find out if that was COVID. And if it was COVID, then all their contacts have to be tested, because that would just that would just give a ripple effect.
All right, Dr. Kemi Odukoya, we'll leave the discussion at this point. Thank you for speaking with us.